Hey everyone, welcome back to DxTx. I'm your host Sahan and Safi. Glad you could join me for another week. This week, we're going to be talking about urinary tract infections and how they're going to be managed typically, as well as how you can prevent your urinary tract infections. For those of you guys joining us for the first time, in the last few weeks, we've been talking a little bit about UTIs or urinary tract infections. We spoke specifically about what a urinary tract infection is, simple urinary tract infections, kind of the common signs and symptoms of a urinary tract infection. And actually last week, we then did another episode and talked about when your urinary tract infection might not be so straightforward. If you missed last week's episode, you can find it right here. Click on the link, have a look, and you can join us back. If you're looking for the link of any of those episodes as well, I'll be making sure to post them in the description below for you guys to have a look. Okay, so to start off, when we're talking about urinary tract infections, the management is actually pretty straightforward for you as the patient. If you're having pain, burning, your pain and your burning, you can actually manage with simple Tylenol as well as Advil. A lot of people often find Advil will give them quite a bit of relief from that burning discomfort until they're able to get in to see a healthcare provider. The next thing that you need as a patient for your UTI or urinary tract infection symptoms is antibiotics. Now, if you look on YouTube, you will find a ton of videos that talk about fixing or curing your urinary tract infection without antibiotics, and that's not necessarily always accurate. And we're going to talk about that a little bit more. Specifically, when it comes to the management of urinary tract infections, your clinicians are really going to be working to try to figure out what type of a urinary tract infection you have. And if you remember back to our last episodes, we're talking about urinary tract infections like those simple urinary tract infections or those more complicated infections. If it's a simple infection, you'll need antibiotics. Usually these antibiotics are going to be tailored to antibiotics that may have worked for you in the past. If you've never had a history of a urinary tract infections, we often have guidelines within the community that allow us to dictate what the best antibiotic is going to be to help you get better. If your healthcare provider thinks that you have a more complicated urinary tract infection, then they might tailor a more specific antibiotic to help you deal with that infection. So, for example, if they think you have an upper urinary tract infection or a kidney infection, then they may prescribe you antibiotics that definitely are going to help resolve your kidney infection. If they feel that this is something more complicated or requires more urgent assessment and management in the hospital, they may refer you to a hospital. But really, the bottom line and what I want you to take away as patients is to know that if you have a urinary tract infection, most likely you're going to require antibiotics. What about all these other cases where you read someone maybe got a urinary tract infection and tried cranberry juice and the cranberry juice helped, or they drank lots of water and the water helped, or estrogen creams, for example, for postmenopausal women, if you've hit menopause, are shown to have some benefit as well. What about those cases? Why do I need antibiotics if I have urinary tract infections and I can just treat them with another simple option? If you're asking these questions, the answer is unfortunately not very straightforward. We know as clinicians that the data really shows that up to from 25 to about 50% of urinary tract infections may just get better on their own. So it's hard to know whether or not these patients or these case reports of people getting better with cranberry juice or some other natural alternatives really got better as a result of the alternative that they were using, or whether they just got better on their own. If you're somebody who gets urinary tract infections frequently, the bottom line is if you're familiar with your symptoms and you've had your symptoms for a couple of hours and 90% of the time it seems to just get better on its own, if you wanted to try some Tylenol, Advil, stay hydrated, drink lots of fluids, monitor your symptoms and see how they go before you contact a healthcare provider to go and get seen, and you're able to tolerate your symptoms, then really that's probably a safe thing to do. As long as you make sure if things are getting worse or if you're not getting better within about 24 hours or so, you definitely need to probably get checked by a healthcare provider to ensure that there's nothing else going on and to make sure that that infection, like we mentioned in our previous episodes, doesn't spread higher to the level of your kidneys and makes you very, very sick. The next thing that's important to mention when it comes to antibiotics is if you have antibiotics that are lying around at home for whatever reason, the reality is you shouldn't have antibiotics just lying around at home, because that probably means that you didn't take them as you were supposed to. But if you do, definitely don't just take them without consulting a healthcare provider. Antibiotics are not generic. You can't just use antibiotics for every run-of-the-mill infection. The way that we choose antibiotics is we try to target them to the specific infection that you have. So, for example, if you're taking amoxicillin for your urinary tract infection, that's not going to do anything because it's not going to work against a lot of the bacteria that cause urinary tract infections. So make sure you don't just start taking antibiotics that are lying around. The other thing that we often see as clinicians in the hospital is that we see patients who are sent in or who come in and say, I had a urine test, I was told that my urine test is positive, I was given antibiotics despite not having any symptoms. We as clinicians call this asymptomatic bacteriuria, which means you're asymptomatic and you have bacteria in your urine. We have lots of evidence now that's suggesting that if you just have bacteria in your urine, but you don't have any symptoms of a UTI, the ones that we discussed in our first video, then you probably are not going to benefit from the use of an antibiotic. Most of these cases resolve on their own. A lot of the times they're contaminants from bacteria within the region. So really, as clinicians, we get worried about patients who are having those symptoms of a UTI with a confirmed finding of bacteria in their urine. If you don't have symptoms of a UTI and there happen to be bacteria in your urine, most likely that's probably resolved by the time that you've gotten that result. In the emergency department, we also see a lot of elderly patients who are brought in by their family members who think that they have a UTI because they've been acting unusually. If you are an elderly patient, or if your mom or your dad who have a lot of different illnesses or acting unusual and you've been told that, oh, you know, if they're acting unusual, it could be that they have a urinary tract infection, that's not necessarily true. If they're able to provide you with an accurate history, they're able to provide you with clear symptoms and they're reliable, then really, again, in the absence of symptoms, confusion, delirium, people acting in a bizarre way, being more tired, more fatigued, doesn't really fit with a urinary tract infection and requires further assessment. Oftentimes we get caught as clinicians when we say, oh look, your urine test is positive. Maybe the way that you're behaving is related to a urinary tract infection. In reality, a lot of the times this is not correct and there's probably something else that we're missing. And clinging on to the fact that this could be a urinary tract infection on the basis of a positive urine dipstick is likely not the best thing to do for the patient. Okay, so now we've talked about UTIs, when your symptoms may not be as a result of a simple urinary tract infection, and we've talked about the management of a urinary tract infection. But let's talk a little bit more about how you can prevent urinary tract infections. As a healthcare provider, I often say prevention is the key to success when it comes to medicine. You want to make sure that you're dealing with a problem before it becomes a problem. And so prevention for urinary tract infection is very important. There are a lot of simple things that you can do as a patient to prevent getting urinary tract infections. Number one, you want to make sure that you're always wiping from front to back. By doing this, you're avoiding allowing that bacterial flora around that anal cavity to contaminate the vaginal area and the urethra, and therefore you're avoiding that bacteria from making its way up into that urethra and your urinary tract, causing signs and symptoms of an infection. Number two, you want to make sure that you're drinking plenty of fluid. So we always encourage you to stay well hydrated, and by staying well hydrated, you're going to ensure that you're always flushing out that urinary tract and preventing bacteria that may have settled there from settling there permanently and causing those signs and symptoms of an infection. So definitely make sure you're staying hydrated. Depending on the source that you're using, there is a bit of variability in terms of recommendations for how much water you should be drinking per day, but I like the 8x8 rule. It's easy to remember. You should on average be drinking about 8-ounce glasses of water per day, which equals about 2 liters or so of water per day. As long as you're doing at least that much, then you'll be ensuring that you're flushing out your urinary system regularly and preventing those signs and symptoms of a UTI. Number three, along the same lines of what we talked about staying hydrated, you want to make sure that you're not holding your urine for excessive amounts of time. Again, if you need to pee, make sure you're emptying that bladder, because the longer you wait from time of needing to empty your bladder to actually emptying your bladder, then you're allowing for that bacteria to settle within that urinary tract and cause an infection. Number four, you want to make sure that if you are sexually active, You're always making sure that you're urinating after sexual intercourse. The friction that is oftentimes a result of sexual activity can cause bacteria to make their way around that genital region, for women especially, and so you want to make sure that after sexual intercourse you're peeing, and again, if there's any bacteria that's sitting in around the urethra, it's being flushed out by the urine. Along the same lines of sexual intercourse, you want to make sure you're avoiding things like spermicidal condoms. Spermicidal condoms are shown to change that bacterial flora within your urethra and that genitourinary region for women, and also make you a little bit more prone to urinary tract infections as well. Now, the last three things we're going to be talking about are the things that you're most commonly going to find on YouTube that are really going to be talking about how you can oftentimes treat your urinary tract infections, or the best way of preventing your urinary tract infections, and that's cranberry juice, as well as probiotics, as well as estrogen cream. So let's talk about these in a little bit more detail. So first of all, you're going to find a lot of things online, on the internet, on YouTube, that's going to be talking about cranberry juice for the treatment of UTIs. And what we know is that really there is not enough evidence right now to support the use of cranberry juice for the treatment of UTIs. There are some studies that show that cranberry juice may have some efficacy in the prevention of urinary tract infections, but it's not very strong. So if you like cranberry juice and you like to drink it regularly, go ahead, go for it. Really, the biggest barrier is cost, but don't think that it's going to be the way that you're going to be curing your urinary tract infections. The evidence really doesn't support that at this time. If you're more interested, there was a research article that was actually posted in Nature Reviews Urology in 2018 that talked about cranberry juice specifically and kind of reiterated this fact. They looked at the evidence currently that exists within the literature and found that cranberry juice really didn't have a lot of benefits in terms of prevention as well as treatment of urinary tract infections. If you're really interested in evidence of what exists currently in the literature, and you're just a really keen patient and you want to know what are the studies, I want to read these studies, I don't buy them, or I do buy them and I'm just interested, then there's actually a good article posted on the CADTH website. That is the Canadian Agency for Drugs and Technologies and Health website that goes pretty in-depth into the current literature that exists about cranberry juice, as well as things like estrogen creams for the treatment of recurrent urinary tract infections, and we'll post the link for this below as well. Last thing that we're going to be talking about is probiotics. So some people believe that if you're taking probiotics, that you're essentially ensuring that the bacteria that's not wanted within your urinary tract doesn't have an opportunity to grow within your urinary tract, and so it'll help prevent getting urinary tract infections. Similar to what we talked about with cranberry juice, there's not a whole lot of evidence to support this, and in reality we know that probiotics are pretty healthy. So if you want to use probiotics because there's little harm and money's not a big barrier for you, then go for it. The harm is quite low. However, if you're taking probiotics specifically on the basis of you believing that this is going to prevent your urinary tract infections, the evidence right now isn't very strong and doesn't really support this. So you could probably save your money. Okay, so that wraps it up for this week's episode of DxTx on the management as well as the prevention of urinary tract infections. I hope that you learned something new. As I mentioned, if you didn't get a chance to watch our initial videos on do I have a urinary tract infection, as well as when your symptoms may not be just a straightforward urinary tract infection, we've posted the links to these videos on the description page below. And as always, please remember to like, comment, and subscribe to the channel. I always look forward to having your support. As a reminder, I just wanted to mention that if you are having any of the signs and symptoms that we discuss in our videos, DxTx and our channel is strictly meant for informational purposes only, and it is not meant to be used as a substitute for medical advice. If you're concerned at all in any way about signs or symptoms that you are experiencing, we always recommend that you get prompt and timely access as well as assessment by a qualified healthcare provider to determine what's going on and how best you need to be managed.